Hello everyone, today we'll be talking about the REMS of the spine. You see this document that I'm having here, the document on the screen, you can actually find it on Google. You just Google Arthritis Research UK, examination of the musculoskeletal system, and you can find and download this document. So when you're doing REMS, regional examination of musculoskeletal system, you follow this sequence in any REMS. So first you look, then you feel, then you move, and then you do a functional test. But for REMS of the spine, there doesn't seem to be a functional test that they list here. So we're just gonna do look, feel, and move. So first, look. What do you look for in the spine, and how do you look for it? So first you need to ask the patient to stand straight and expose their back or expose their spine, obviously if you want to look at it. So you observe from two positions. The first position, you position yourself behind the patient, and then you're going to look for any obvious muscle wasting of the back muscles, any asymmetry, or any scoliosis. These are what you can see from the back. And then from the side, what can you see? You can see lordosis and kyphosis. Next, after look, we go on to feel. Look, feel, move. Feel, you're gonna feel down the spinal process. So right in the middle of the back, where there are bony protrusions, you feel from the neck down to the lumbar area, and then you feel for the sacral down to lumbar area, then down to the sacral area, and then you feel for the sacroiliac joints for alignment and tenderness. After that, you palpate beside the spine, palpate the paraspinal muscles for tenderness. So look, feel, next comes move. So for move, their sequence is a little bit jumbled up here, but I'll just go through it first. So let's say assess lumbar flexion and extension by placing 2 or 3 fingers over the lumbar spine. Ask the patient to bend to touch their toes. Your fingers should move apart during flexion and back together during extension. This is very self-explanatory. I don't think I have to explain this. Next, you ask the patient to run each hand in turn down the outside of the adjacent leg to assess lateral flexion of the spine. So yeah, next, assess the cervical spine movements. So they assess the lumbar spine and then suddenly jump to the cervical spine. Ask the patient to tilt their head to each side, bringing the ear towards the adjacent shoulder, that's lateral flexion, and then turn their head to look over each shoulder, that's rotation, and bring their chin towards their chest, that's flexion, and tilt their head backwards, that's extension. Next, with the patient sitting on the edge of the couch to fix their pelvis and their arms crossed in front of them, assess thoracic rotation with your hands on the patient's shoulders to guide the movement. You can see on the figure here, the purpose they ask the patient to sit is to fix the pelvis so that the pelvis doesn't rotate with the spine, so rotation purely comes from the spine. Next, you lie the patient flat, head facing upwards, facing upwards, and perform the straight leg raise. This is where you, it's shown here. You raise the leg, and then if the person has sciatica, this will stretch the nerve, and then impinge it on whatever is coming up from the back, be it a slip intervertebral disc or any other impingement outside the spine. It will cause the pain to occur. And then when you dorsiflex the leg, that would make the pain even worse. That's a positive straight leg raise test. Okay. Next, you assess limb reflexes. It says both upper and lower limb reflexes, and also the dorsiflexion of the big toe. I'm not sure why this in particular, but after that they say that a brief A neurovascular examination should be carried out, including assessment of the upper and lower limb reflexes, dorsiflexion of the big toe, this is redundant, and assessment of the peripheral pulses. If there has been any indication from the history of a relevant abnormality, a full neurological and vascular assessment, including sensation, tone, and power, should also be made. So it's quite jumbled up because you go from the lumbar to the cervical area, then you go back to the lumbar area rotation again. So the way I like to do this is go from top to bottom. So top first, you're gonna do the cervical spine. Cervical spine, you're gonna ask the patient to do the lateral flexion of the neck, and then flex the neck and extend the neck and rotate the neck. Next, you're gonna go down to the lumbar area. So first you ask the patient, you put the two fingers behind at the spine, and then you're gonna ask them to flex, bend downwards, and then try and touch their toes. Your fingers should move apart when they flex and then move back when they extend back. So next you do the lateral flexion of the lumbar spine. Same as what was mentioned just now. Ask them to slide their hands down the side of their thighs, and then ask them to sit down, and you test for rotation of the lumbar spine. So sit down to fix the pelvis, and then hands crossed and rotate their shoulders. Now you ask them to lie down, and then follow exactly as what was mentioned just now. Straight leg test, and then neurological examination and reflexes. So in summary, for REMS of the spine, you do look, feel, and move. For look, you observe the patient from 2 points from the back and then from the side. For feel, you're going to feel for the spinal process and then the paraspinal muscles. And then for move, you're going to assess the lateral flexion, the forward and backward flexion and extension, and rotation of the cervical spine and the lumbar spine. And then you're going to lie the patient down and do the straight leg test, and then do the reflexes and neurological examination. That's simple and easy. Thank you.